Greetings, we are the Group 1, and now, we will show you the things you must need to do if you will encounter unexpected scenarios that we will be needing to perform first aid and the two assessments. The two assessments is called the primary and secondary assessment. And now, let's begin.
Are you okay?
Yes, are you sure? I'm good. Medyo, hindi kaya. Sigurado ka?
Hoy!
While others call for help, tap the shoulders of the patient to check if conscious may return, and constantly check the patient's pulse to know if the patient is still alive.
Ako kasi nahimatay dito. Saan? Okay po, yung address po dito po sa boardwalk. Kasi saan po? Pacific Bay. Okay, bilisan na lang po ha. Maraming salamat po.
Primary assessment. A primary assessment is the first examination and evaluation of a patient by a medical person such as a trained emergency medical technician or other first responder to an emergency situation, and is focused on stabilizing the patient. Raise the leg of the patient to bring back circulation. Check the pulse. And lastly, check for CAB or CAB. C is for circulation. Feel if the pulse is present. Check by touching areas like the neck or wrist where large veins are visible. A is for airway. Remove any material that blocks the airway.
B is for breathing. Check the victim if breathing by putting the palm above the nose of the patient.
And now, let's move on to the secondary assessment.
A secondary survey is used to help the first aider determine injuries or illness that may be present in the casualty. It should only be used if the casualty has more than one injury, if ambulance is not immediately available, or if the primary survey did not reveal any immediately life-threatening injuries. The proper position for doing head-to-toe exam is to extend the patient's arm, as long as there are no fractures, for the rescuer to straddle but not to sit on the patient's arm, so that the first aider is in a good balance to start the head-to-toe exam. The first responder should use medical or first aid gloves because one of the key dangers to first aider is bodily fluids. If someone has a blood transferable disease, disposable gloves help to protect against the transmission of disease and illness. The first aider must check the vital signs of the victim. Abnormal pulse rate or breathing, dilation of pupils, change in skin color or body temperature, changing level of consciousness or being half awake. Head-to-toe examination. The first aider must think of the acronym DOTS to inspect the whole body of the victim. D. Deformity of fractures. O. Open wounds. T. Tender parts. S. Swollen parts. For head and neck, gently check if there is no blood, bruising, swelling to the structure of the bone. Checking the arm for any obvious fractures, deformities, or bleeding. Checking the legs for open wounds, tender parts, or swollen parts. If the casualty is responsive and able to talk, the first aider can ask questions using acronym SAMPLE. S. Signs and symptoms, allergies, medication, previous medical condition, last oral intake, events that led the emergency situation.